Namaskar, I'm Ashok Vyas, and today, as you see, I'm sitting in the hospital, and the reason for my place being the place as it is, you see on the screen, is the presence of someone who is talking about hospital and the working of doctors and mindset of doctors, especially these days, in a very candid way. And he shares the insider's perspective that he successfully did with his first book, which was called Intern. And now Dr. Sandeep Jauhar, who is a cardiologist, and he works for Long Island Jewish Medical Center. We read his columns regularly in New York Times. And now here you see this book, Doctored. So let's, before we move towards doctor, let's talk about your need to write. Your profession is so demanding. You don't really have a lot of time for anything else. Yet you are persistent in continuing to write columns. What is it that drives you?
Well, I've always enjoyed writing. It's just been something that has always given me a lot of pleasure. And it's also something that allows me to process my experiences. Being a physician is, as you said, very demanding, and it's something that where you see some of the most poignant things that human beings can experience. Very, very high, joys, and then real depths, real lows, life, death. So they're very powerful experiences, and I found a long time ago that unless I write down and think about my experiences, I sort of lose them. And so this is something that I've always enjoyed doing, and medicine very fortunately provides me a way of writing about something that people are genuinely interested in, and it gives me a forum to do that. So it's something that I really love.
Yeah. Dr. Sandeep, very quickly, maybe it'll help some other writers out there. Many people feel like writing. There is an inkling in them to express, but that is confined to their diary, which is either just for themselves, or maybe it is not as polished, or it doesn't have that kind of shine, which would make it travel to that place where it may find itself in New York Times.
Right.
So let's talk about the art of writing. Have you consciously worked on it, the craft of writer skills?
Yeah, absolutely. I mean, I find writing really difficult. I mean, as most people do. I might write, 500 words in a day and maybe keep at most 50. A lot of what I write gets discarded. And so you mentioned about diaries. Well, I think most writing, and especially personal writing or memoir writing, starts in a diary format. You have to open up the page and put down your thoughts without screening them or editing them or worrying about what impact they're going to make on the reader. You have to just put it all out there. And what I've always strived to do in my writing is be as honest as possible, because especially when you're writing memoir, readers want you to be candid, and they want you to be honest about your own foibles, your own mistakes, as well as the profession in which you work.
And let me interrupt you. And some of your columns have raised lots of hue and cry, and it has raised a kind of very volatile, dynamic debate amongst the readers of New York Times, and people keep on adding their comments after comments.
Right.
So the number might be more than 1,000 sometimes.
Yes.
And do you read most of them, and how that makes you feel? One aspect that so many people found it worth responding to.
Yeah.
Second, some of their comments are probably not very easy to digest.
Yeah, well, that's definitely true. Anytime you write in a forum that has such a loud and expansive audience like the New York Times, you're going to get a lot of feedback. And, a lot of the times it's very positive. But most of the time, if you're going to write something worth reading, there's going to be a controversial element to it. And controversial elements or controversial topics, always have two sides, and usually multiple sides. And there's usually a substantial number of people who agree with what I'm saying. For example, I wrote a piece about nurse practitioners a few months ago, and it was the most emailed article on the New York Times website for several days, actually. And it made the argument that maybe we should be a little careful about giving nurse practitioners independent status. In other words, right now, nurse practitioners in New York State have to collaborate with a physician, but a law was recently passed that will allow, as of January, will allow nurse practitioners to practice independently. So I raised the question, is this safe? Is it cost effective? What are the reasons? And you can imagine that a lot of physicians were very happy with what I was saying, and a lot of nurses and nurse practitioners were very upset. But there are other situations where I point out problems in my own profession or with doctors where the doctors are very unhappy and nurses and patients are, applaud what I say. So, this happens a lot. You have to develop a thick skin. My goal is not to make a lot of friends, but to get out the issues that I think are important and be a voice for those issues. So that's what I try to do.
So what you try to do is really not an easy thing to do, to develop thick skin or to have the ability of not being affected by what people are saying about you, and especially when you're the director of the heart failure program at Long Island Hospital, that puts an additional, call it burden or concern on your shoulders, that how people perceive you. And if you are following the policy of being honest, it might lead you to some avoidable trouble.
Yeah.
So how, I know you would understand what I'm saying. So do you follow some cautious way, or is there any formula that this much I should say this, where I should stop?
I don't follow a formula because, like I said, if I'm going to write about something, I'm going to express my opinion openly, candidly. And in this book, Doctored, I write a lot about myself and my own personal journey in medicine and the disillusionment that I experienced. And I had to do it in a very candid way. It was something that was important for me to just get out in an unvarnished way.
Let me interrupt you, because the title itself is very sort of in your face types, where doctored, and the subtitle is The Disillusionment of an American Physician. And we always have this compulsion to say good things about where we are, and not be as bold as you are, right? From even before you open the book, you know that what he's talking about. So let's talk about the internal journey of coming to this conclusion and being so clear and bold to share it in the way you have done it. It must have been an agonizing experience.
Well, the experience of becoming disillusioned and going through a crisis, really, of sorts, over a span of several years was agonizing. But, I had to come out of that crisis to get the energy to write about it. So I would say the crisis really was from, 2005 to maybe 2009. And then since then, things have really improved, for me personally. And so that was a source of energy that allowed me to write about this experience. But you asked about, do you worry about what people say? I mean, we're human. We worry about what people think, and we don't want to hurt anyone, especially when you're writing memoir where there are other people in your life whose stories intersect with yours, and how do you pay them respect and keep their information, confidential, private. So these are issues that one has to struggle with. Of course, no one wants to write something that will upset his or her colleagues, to a significant extent. But I've been very fortunate in that the book, even though it points out a lot of weaknesses in the American healthcare system, I've gotten really positive feedback from doctors, from nurses, from other healthcare providers, and from patients. See, everyone sees the system that we operate in as fairly dysfunctional. Doctors are unhappy with the system, not just me. Patients are unhappy. I mean, you talk to patients, they know this system is not serving their needs.
You talk about an internist. You refer to this example that they used to see 15 patients a day. Now they have to see 30 patients a day.
Yeah.
So that reduces the quality care that they can offer. Now, that is a conscious decision of this affordable care or the Obamacare, which has resulted into it, or
No, I wouldn't say it has anything to do with Obamacare. What is driving it is that primary care physicians have increasing overhead and decreasing reimbursement. All physicians are experiencing that, but primary care physicians, because they think about problems and they don't actually do procedures and tests and surgeries are highly reimbursed in the American healthcare system. But thinking about a problem, trying to figure it out, sort of the cognitive aspects are not well reimbursed. That's what primary care physicians do. It's more thinking and less doing. So primary care physicians many have found that to make ends meet, to pay their overhead, to pay their office staffs, to pay their rent, to pay their malpractice insurance, they have to see more and more patients, and then to keep some income, they have to see more and more patients. So, there was a time, maybe a couple decades ago, when you might be able to see 10 or 15 patients a day. Now, a lot of primary care physicians are seeing 30 patients a day. 30 patients a day is an inordinate number of patients to see, especially because now in America, more and more people have chronic health problems. They don't have just one problem anymore. They have multiple problems: diabetes, congestive heart failure, hypertension, coronary artery disease, and it goes on. So these patients are more and more complicated, and so it should be taking more time. You should be spending more time with patients. Instead, we're spending less time because of economics. And I think that's why a lot of doctors are very unhappy, because the system is not allowing them to practice in a way that it comports with their ideals. And that was my problem. I had these ideals coming out of medical school, out of my training, and then I was faced with the reality where I had to see more and more patients. I was unable to sort of make ends meet with my salary. I had to take an extra job, moonlighting, and I had to work for, I worked for a doctor who was doing a lot of unnecessary tests, and I just found myself feeling dirty about it. And that's what led to my personal crisis.
So now let me just take a segue from what you said. I think it is very rare for people to live with their ideals. Many people do compromise without even sharing their pain or their suffering, that they are not in a position to follow through with their ideals. But there are very few individuals like Dr. Sandeep Jauhar, and let me take the liberty of sharing with our viewers also that before getting into the medicine, he was a PhD in physics. So there was something in him which compelled him to start afresh, and it's not easy to start afresh. So there was some sort of very intense ideal sort of inner pressure that probably brought you to this side of life. Now, when you write this book, Doctored, which is divided into three main parts, starting with ambition, asperity, and adjustment. And since we have very little time, so what was it that guided you in dividing your book in these main three parts?
Yeah. Well, I mean, it's a memoir. It's my personal story. So the story is what it is. But the story happened to, fit nicely into sort of these three parts. So the ambition part is me starting off as a cardiologist. It was in 2004. I started at Long Island Jewish Medical Center. I had been in school or training for 19 years after high school. I did college, graduate school, medical school, internship, residency, fellowship. So this was an inordinately long training process. And I was ready to get some reward for all that work. And, when I was growing up, my mother used to say, I want you to become a doctor so that people will stand when you walk into a room. She had that ideal of the doctor from India. And my grandfather was a doctor, and he was highly respected in his community. And even in the United States, one generation ago, or let's say in the 40s, 50s, even the 1960s, doctors were held in such high esteem in society. They were, one shade below, one rung below astronauts in the respect that they commanded. And if you were smart and sincere, ambitious, your parents pushed you into medicine. And we still see that in the Indian community. So I sort of had these, these visions in my head. And then I started in medicine, and I found that doctors, instead of being satisfied, were very burnt out, very demoralized, and a lot of it was driven by the fact that they had to practice a lot of business. Most people go into medicine either because they're interested in the human body, or they're interested in helping people. There aren't too many other good reasons to go into medicine. Most people don't go into medicine to make a lot of money. That I really believe to be true. But a lot of doctors were practicing with the eye on the bottom line, having to see more and more patients to keep their incomes. And no one wants to do that. Most doctors don't want to do that. So they were unhappy. And I saw that a lot of them were ordering unnecessary tests. And I told myself that's not how I want to practice. So I started working in an academic hospital. But what I found is that my salary, I had some financial pressures, and I had to take a job moonlighting. And then I ended up doing some of the same things, or at least working with people who were doing those things. And it was...
So I interrupt you, Dr. Sandeep, just to say that we need people like Dr. Sandeep Jauhar in all the professions, people who can see through the system as it is and have the courage to share where lies the problem or what is the possible ramification that may bring back something which resonates with ideals. But let me read some comments about your book. One more says, Jauhar offers, if not a cure, a prescription for restoring dignity to patient and healer alike. And Siddharth Mukherjee, author of The Emperor of All Maladies, a biography of cancer, again a doctor and a writer, he says Sandeep Jauhar's Doctored is a passionate and necessary book that asks difficult questions about the future of medicine. The narrative is gripping and the writing is marvelous. But it was the gravity of the problem so movingly told that grabbed and kept my attention through this remarkable work. Now, if you have not read the book, you might think it might be a boring book, which is definitely not the case. The narrative pulls you along with it. And just to give you an idea of the kind of writing which comes from Dr. Sandeep, I would request you to share maybe a small portion of the book.
Sure.
And I believe you are picking up the opening.
Yeah. So I'll just read the prologue. The prologue actually takes place sort of in the depth of my crisis, and then the book starts several years earlier, and it traces the story up until the crisis, and then it goes forward into the resolution of the crisis. So I was actually, in a place in an actual storm, and so I wrote, "I'm walking on a muddy path. The rain has ceased, and puddles are shimmering in the moonlight. I'm wearing olive green Gap pants, beat-up Hugo Boss shoes, and an orange Patagonia windbreaker. I am the picture of success. I start to run. Trees and poles hurtle past me as, head down, eyes fixed, I sprint down the trail. Wet leaves scrape against my face as I swat them away. Shadows oscillate. The wind is swirling like a loud yawn from heaven. I stumble on roots, but I keep on going. Sleep has been hopeless. I haven't been able to nod off for more than a few hours at night, and sedatives leave me even groggier the following day. A strange feeling has taken hold of me, and it won't let go. It isn't anger, I told Dr. Adams, my psychiatrist, as much as butterflies in the stomach. Why the anxiety, he asked. I don't know, but I'm waking up with it, and the workday hasn't even begun. How do I make it stop? And then it goes on.
Do you see these kind of books, or maybe Doctored, has the potential to bring about the desired change?
I really hope so. You have to sink into the depths before you sometimes can see the light and start changing. This happens on a personal level, and it can happen on a widespread professional level. I think medicine has gotten to that point where it is in such a dysfunctional state in this country that people want to see it change, and people realize it has to change. Today, if someone says, oh, in America we have the best medical system in the world, people are more apt to laugh at this person, because American medicine may be the best in the world when you're dealing with a very special illness or special problem. But for most people who have chronic, run-of-the-mill problems that require coordination and require communication and require time with their doctor, the American system is failing miserably.
So American system is failing miserably. We leave our conversation at that point, and of course, to support what he just said, I take Hatching a Plan chapter from his book, and just 2 lines where it is a conversation between his father and mother. So my father, I read, my father turned to my mother with a disbelieving look. I think he's obsessed. He never used to be so money-minded. What is he supposed to do? My mother cried in Hindi, rising to my defense. He cannot cover his expenses. Now, the cover of this book tells the story, the disillusionment of an American physician. Sandeep Jauhar, author of Intern, has brought another wonderful gift for us, not only to cherish, but also to grow with. Thank you very much, and congratulations. The book, of course, has been received very well, and it's being appreciated. And we appreciate his presence in our studio, as well as thanking all of you for being with us. This is Ashok Vyas.